And again, thank you all for joining this afternoon for our November training entitled Public Health Influence and Authority in Healthy Aging and Brain Health through Policy, Systems, and Environmental Change. And this is going to be presented by our colleagues at ASTHO and specifically the Health Improvement and Healthy Aging team. Uh-oh, going the wrong way. Apologies. Trust for America's Health, just to give you all a background on us. We are an independent, nonpartisan public health and prevention focused nonprofit based in DC. We're committed to making sure that national disease prevention is a national priority. We are focused on evidence-based policy and advocacy with a heavy focus on equity. And we want to make sure that we improve the health of every community. We produce a lot of reports throughout the year. Some notable ones are our Pain in the Nation report, and we recently released a State of Obesity report as well. And the Age-Friendly Public Health Systems Initiative is a project that is, again, focused on making sure that healthy aging is a core priority for departments of health across the country. And we want to also acknowledge that this work is funded and overseen by our generous and wonderful funders, John A. Harvard Foundation. So just a little housekeeping before we begin. Make sure that you keep your devices muted throughout the presentation. There will be time at the end of the presentation to ask our presenters questions, so you can feel free to come off mute. In the meantime, my colleague, Megan Wolf, our Senior Policy Development Manager with Trust for America's Health, will be monitoring the chat as well to keep a log of the questions if you would like to submit them that way. And just to give you an overview of our wonderful lineup of speakers, again, our speakers are with the Association of State and Territorial Health Officials. We have Tyrone Bethune, Claire Pendergrass, Paya Sands, and Priya Shah, and they will be introducing themselves more formally momentarily. And with that, I'm going to turn the floor over to our wonderful speakers with ASTHO, starting with Tyrone Bethune.
There we go. Good afternoon, everyone. I'm happy to kick us off, Karan. Next slide, please. All right, so here at ASTHO, we have a shared vision and mission. The vision, state and territory health officials, advancing health, equity, and optimal health for all. The mission to support, equip, and advocate for state and territory health officials in their work of advancing public health and the well-being. And so with the vision and mission, these elements are directly related to our team's work in health improvement and healthy aging, particularly our portfolio, which includes intentional projects that are aimed to move the health equity needle with that healthy aging lens. And so we work with our health officials to move us into that direction with a positive health trajectory. Next slide. I'll pass it to Priya.
Thanks, Tyrone. Hi, everyone. This is Priya. I'm going to take a second to talk about ASTHO's strategic plan. So the strategic plan was newly revised and is in effect between 2022 and 2024 and includes the following strategic priorities. So you can see them here in the top half of the circle: health and racial equity, workforce development, sustainable infrastructure improvements, data modernization, interoperability, and evidence-based practice. And at the bottom half of the circle, you can see our core function areas, which are the methods that we utilize to achieve our strategic priorities, as well as the values that we prioritize within our organization. And I want to take a second to specifically highlight the core function area of capacity building and technical assistance, which is really where we as a team and organization spend the bulk of our time by developing quality products such as briefs, blogs, reports, and webinars, so that they can be utilized by public health agencies and their staff in order to best serve their jurisdictions. Next slide, please. Awesome. And then earlier this year, ASTHO conducted a widespread environmental scan to track and identify current public health trends within the state and island jurisdictions of the United States. And that scan was conducted between March and June of this year and involved conducting a qualitative analysis of 30 state health improvement plans and 29 state health agency strategic plans. as well as the incorporation of survey results, which were retrieved from health officials in 10 HHS state regional groups. So the findings from the scan were divided into two categories, the programmatic and infrastructural public health priorities. And just wanted to mention that within the programmatic priorities identified in the scan, meeting the needs of the aging population came up as a core public health priority that state health officials are committed to focusing on. And next slide, please, and I'll pass it back to Tyrone.
Thanks, Priya. Here is a snapshot of the wonderful health improvement and healthy aging team: Claire Pendergrass, Priya Shah, myself, and our director, Talia Sands. And our portfolio has a couple of different moving pieces. Brain health, which we have partnerships with CDC and the Alzheimer's Association. We also have healthy aging partnerships with ODPHP, the Office of Disease Prevention and Health Promotion, and TIFA. And we're also doing fall prevention work with CDC. Next slide, please. And so this is the route for today's presentation, our trail map. And so we started with the introduction. We'll cover the public health influence and authority, 6C alignment, resources, and end with Q&A. Next slide, and I'll pass it on.
Thanks, Tyrone, and thank you, TIFA team, for having us. I am going to kick off our conversation about public health authority and influence and the framing behind that by sharing a bit about our perspective on key concepts around healthy aging and older adult health. I know that all of you participating on today's call are well familiar with healthy aging and older adult health. This is not meant to define it, but more so just give you some perspective into how we think about these concepts and how they map onto some of the work that we do. On our team, we like to take a both and approach to healthy aging and older adult health. So the graphic that you see on the screen is intentionally having healthy aging kind of encompassing of older adult health in the middle, or kind of middle bottom of that graphic. We recognize that healthy aging a focus on healthy aging is overarching and really part of the whole of public health's duty to promote health across the life course. We think a lot about, with our healthy aging work, what can public health do to help people age healthily as they age at any age and reach older adulthood as healthy as they can be. But we recognize that healthy aging doesn't stop when one reaches older adulthood, it also spans it. We also recognize that it's important to, in our public health work, be inclusive of the population of older adults and not forget that population in our efforts. So with that, we work to keep that population in mind. That may involve improving quality of life through the older adulthood years, but also note that prevention and risk reduction that span healthy aging are also integral in the older adult years. Next slide, please. So with that in mind, promoting healthy aging and older adult health, we believe requires leveraging public health influence and authority, or authority and influence. And these are the key concepts that we wanted to share today and offer to you as concepts that we leverage throughout our work, but that also may be relevant to you. So whether you're in a public health department or in a different type of agency, there's always that level of authority that you and your organization may have, or that level of influence that you may have to influence other people. So let's get into this a little bit more specifically. By authority, we mean the areas where public health officials or other leaders are authorized to act through policies, through regulations, or other initiatives. An example of what this might look like in a more specific context is public health authority or regulatory or enforcement authority in a policy area such as tobacco control. By influence, we mean the areas where public health officials can encourage another decision maker to take action and address an issue that is outside of the immediate realm of public health. So an example of where this might come up is education. Education, as you may know, is a social determinant of health or fundamental determinant of health, but not necessarily something that the public health department has the ability to directly make decisions about. So here, influence would come in influencing a counterpart in the education sector to support policies that may improve health and wellness in school or education settings. So these concepts guide our work on our team and across ASTHO, and really are part and parcel to much of the work that public health does. There are things that are within public health's authority to do, but so many things, especially around addressing social determinants of health, that require influence. And that is a huge lever that we see an opportunity to address. ASTHO has a few different papers and resources that get into examples of public health authority and influence. They are linked at the bottom of the slide, and they will, I imagine, Karan, the slides will be shared, but we're happy to share the links directly as well. Next slide. So we applied that authority and influence lens across our work, but one of the guiding resources where authority and influence comes into play is ASTHO's technical packages. ASTHO's technical packages are a select group of interventions, strategies, or policies that we believe together will help to achieve and sustain substantial improvements in a particular topic area related to a health outcome, a risk factor, or something else in the public health sphere. We develop our technical packages based on our internal subject matter expertise and assessment of evidence-based interventions. We rely on expert recommendations as well as overviews of current activities in the landscape through partners and others. The ASTHO technical package is not intended to be a comprehensive end-all be-all. It is intended to be iterative and really a focused, narrowed list of potential areas that a health official may take action on or have the ability to influence. This style of compiling a technical package for ASTHO helps us to provide a focused and proactive approach in our capacity building and technical assistance work, and really leverage our strengths and knowledge in a particular topic area and hone our focus. The intention, the concept behind our ASTHO technical packages is to propel health officials specifically forward in their short tenure to make an impact and really hone that focus on a select group of strategies, policies, or interventions in a particular area. As I mentioned, it takes a process of relying on internal expertise and evidence-based look. We conduct literature reviews, get expert input, and prioritize the different elements that go into the technical package. And often this involves looking at influence and authority. In a particular topic area, there may be things that are within the public health department's control, but others that are ripe for making an impact, but require that influence of engaging with other partners or decision makers who have that authority. So there's a couple examples that I screenshotted here. The blue one in the back is related to COVID-19 health equity interventions. And then the orange one in front is the essential policies for chronic disease prevention and control. These are just a couple of examples, not intended to be read in depth on the screen, but we'll share some links to these, or at least the slides, and can provide links to those. These are just a sampling. There are other ASTHO technical packages, such as one on environmental health and climate, immunizations, and sustained COVID-19 management, to name a few. There are often connections, like I mentioned, with social determinants of health and things that are more in that influence realm. So in the examples on the screen, one of those might look like paid sick and family leave for the COVID-19 health equity interventions technical package. And then on the essential policies for chronic disease prevention and control, another example of this is our policies related to environmental changes that would increase access to physical activity or nutrition. Our team is working on an ASTHO technical package that relates to healthy aging and older adult health. So stay tuned for that. And we'll be, again, continuing to bring that thread through of what is public health's authority and what is the area in which they can influence. We do recognize, though, that the strategies across the other ASTHO technical packages support healthy aging, which is kind of a relief, knowing we had to prioritize just a few objectives for the ASTHO technical package we're working on. We recognize that healthy aging, again, is part and parcel to what public health does and touching different parts of promoting health across the lifespan. So for example, the essential policies for chronic disease, that orange one in front, is all about risk reduction, prevention areas that relate to aging healthily over the lifespan. So there are lots of connections to be made, and we encourage you to take a look at these tools for information and inspiration that might serve your work. So with that, I will turn it over to Claire for the next piece. And next slide, please, Karan.
Great, thanks, Talia. So building on the information that we just heard, I'm going to talk or get us started talking about how the age-friendly public health systems 6 C's framework, which I recently refreshed myself, the 6 C's stand for creating and leading policy systems and environmental change, connecting and convening multi-sector stakeholders, coordinating existing supports and services, collecting, analyzing, and translating relevant data, communicating important public health information, and complementing existing health promoting programs. So those align a lot with what I just heard my colleagues sharing in our broader portfolio, but I'm going to start us zooming in a little more on that policy systems environmental change, age-friendly public health system C, and how that kind of maps onto our team's work, particularly on the Healthy Brain Initiative, but it plays out in our broader healthy aging work, and how partnerships are key to public health work on this topic in general, and how partnerships benefit policy systems and environmental change. Could I move to my next slide, please? Grand. So this slide is talking about systems level strategies and collaborative approaches to Healthy Brain Initiative work. And for those new to the PSE acronym, as I recently was, it stands for Policy Systems and Environmental Change. And a big part of our thinking is kind of understanding how public health work that's already happening often can be easily translated or kind of expanded and designed to turn into a PSE approach, or maybe it's a PSE approach already and that language wasn't being used. So just to kind of contrast the individual event or program style, that might be an individual level, like intervention or educational activity. It might be one time or produce short-term behavior change, and it might not be part of an ongoing plan. So not at all to say that those are bad approaches. They're really key to much public health work. PSE change kind of builds on that and turns those individual level approaches into community and population level approaches. It kind of creates an ongoing effort to address a particular health priority, and it builds behavior change over time by altering the systems and policy contexts that make the health behaviors the easy choice, or that kind of affect the entire environment someone is exposed to, so that it's not having to be individual changes one at a time. And it's really important to consider the sustainability of these public health efforts. So in Healthy Brain Initiative work, wanting to be sure that, especially given the long time frame of dementia as a public health issue, that these sustainable public health efforts are going to be lasting for years and creating lasting public health impact. And in terms of partnerships, these are really key to creating these systems and policy changes, because public health partners can, those who aren't maybe sitting in a health department, can support advocacy where there might be constraints on that type of work, and they can embed the principles of public health and Healthy Brain Initiative work specifically into their own organizations and systems, and often bring trusted relationships that can be really valuable to public health's mission. And continuing implementation when resources are constrained is another really key element of partnerships. And this little excerpt is a sneak peek into a whole webinar on this topic that you will hear about in a moment when we get into our e-learning resources. But just wanted to, if this was interesting, there's more, and an awesome real life example from Dr. Keena White in Mississippi, who is a rock star at applying these concepts. And then next slide, and I believe I'm passing it back to Talia here.
I think we set out to kind of highlight the connection to some of our concepts and work to the 6C related to policy systems and environmental change, and quickly realized we could not do that without also talking about partnership, like Claire mentioned, that they're so critical to one another. And I'll next share about an example of utilizing partnership and really using the opportunity to build that partnership and collaboration as an inroad to making policy systems or environmental changes. So back in 2021, ASTHO had the opportunity to partner with TIFA, thanks to funding from the John A. Hartford Foundation. We set out to do a pilot project to crosswalk a state health improvement plan and a state plan on aging. We worked with the state of Georgia. They had a partnership that was already existing and continuing to blossom, and we're really ready to take some action. We at ASTHO took a look and scanned both of those state plans, the state plan on aging and the state health improvement plan, to look for areas of synergy. So where was there similarity, difference, or unique characteristics amongst the strategies and objectives in each of those two plans? We compiled the findings from that scan and shared it back with the Georgia team, and facilitated a process for reviewing those findings. That discussion of the findings led to charting a path forward for strategically collaborating between the Public Health Department and the Division for Aging Services on a couple of key areas. They identified two shared priorities, one focused on social determinants of health in rural areas, and another on leveraging existing data that they each had about older adults to inform their activities moving forward, as well as share it outwardly with the public and their partners. So this whole process furthered partnership between the Public Health Department and the Aging Agency in an effort to work together to improve older adult health and work together to support healthy aging more broadly. The process helped to align those existing priorities that were already in their plans and identify where they could take it to the next level and collaborate further. And as you can tell from one of the shared priorities, one of those included a focus on social determinants of health, which I know is a key theme across the Age-Friendly Public Health Systems Initiative and the training series. This whole project was really inspiring and a lot of fun, and brought together authority and influence of both the public health and the aging agencies. They both brought their authority or different partnerships and connections that they had to the table. So for example, the Public Health Department brought their experience, expertise, and resources with regard to data related to health and well-being across the lifespan and for older adults. They both brought their partnerships and connections with rural communities and worked together to connect with those communities and again, lead towards some more policy systems or environmental change focused efforts. So together they brought their expertise, their authority to the table. They brought their influence of one another and set out to bring that influence together with partners across their state. Next slide, please. For those that might be interested in learning more or wanting to model this, we encourage you to take a look at a couple resources that we have. We recently published a journal article about the project where you can get a high-level overview of the process. And then we also have a podcast from earlier this year that includes some interviews with a couple of the participants from the pilot project that is also very inspiring. So we encourage you to take a look and listen to those. We did take an intensive approach to the crosswalk. It was a process, but a one that was well worth the time and effort. We explain that more in the article, and want to share that it doesn't have to be as intensive as what the path we took, though. Really, we found towards the end and reflecting with the team about the project that intentionally making the time to sit down together to review and learn about one another's plans allowed them to start and continue a conversation that furthered their partnership and made it easier to find those natural intersections for collaboration so that they could create those mutual actions to reach some shared goals. So with that, next slide, and I will pass it over to Tyrone.
All right, next slide, please. All right, so last month, Claire and I, we published the latest state health policy update blog around dementia and the fiscal impact within the states. And in recent years, states have enacted legislation addressing dementia through long-term care services, state planning activities, training requirements, alert systems for missing persons living with dementia, and other mechanisms to address fiscal concerns. Dementia and cognitive health are significant health priorities, and it is essential for ASTHO, public health, healthcare organizations, and interdisciplinary partners to play an active role in the policy, systems, and the environmental change process. And ASTHO is committed to monitoring these policies and providing updates around this issue. Next slide.
So this slide is describing a platform where you can access a lot of the resources that we've been describing in this presentation, and the ones specific to the Healthy Brain Initiative are housed in this e-learning module, and you'll hear there's another e-learning module in a moment. But the Healthy Brain Initiative e-learning module, to give ourselves a moment of praise, was recently recognized as one of ASTHO's top 10 most popular products of this past year. So we're very proud of that. And it is kept updated and more content is added regularly. Currently, it contains 2 sketch videos, which are these really beautifully designed, engaging videos that are animated and walk through both the concepts of brain health and the public health role, and are kind of a visual learning approach. So those are available, as well as 6 recorded webinars, 1 podcast, and then 5 planning and needs assessment tools that are really well suited to the public health agency role in addressing dementia and brain health. And some benefits of this e-learning module design is that it can be self-paced. So depending on your schedule, you can use the resources that would make sense for how much time you've got. You also don't need to go through every single thing. You can kind of take an a la carte approach and review the little descriptions and see what seems to align with your needs or your learning style, whether you're looking for webinars or more usable tools and checklists. And we work really hard to make the production of the materials engaging. So we hope that they are both useful and fun to use. Next slide, please. And just to spotlight a few specifics that we think might be handy, this on the left, building a strong jurisdictional plan for dementia and dementia caregiving, is a pretty brief resource, but shares kind of the key best practices that might be useful for someone in a state health agency looking to begin a jurisdictional plan addressing dementia and dementia caregiving. The one in the middle is an excerpt from our action planning facilitator guide, and there's also a usable PowerPoint presentation that goes along with this. So it's kind of saving anyone from reinventing the wheel and giving you checklists, ideas, best practices that draw on both ASTHO's subject matter expertise and the experience of others who have been doing this work on the Healthy Brain Initiative. And then on the right, as I mentioned earlier in the presentation, this webinar that we did over the summer focuses on systems level strategies for implementing the Healthy Brain Initiative roadmap. And it both walks through kind of conceptual ideas of policy systems and environmental change. It gives some specific ways that might look in the context of the Healthy Brain Initiative roadmap and how to translate individual to systems level approaches. And then we have the example of Dr. Keena White in Mississippi describing how her health agency planned for sustainability and adopted a systems level approach and leveraged partnerships, which is just one of my favorite webinar presentations I've heard in a long time. So highly recommend checking that out if you have a chance. And then next slide, please. And lastly, the materials that ASTHO develops for the Healthy Brain Initiative attend to health equity kind of throughout the steps of whether it's learning about the Healthy Brain Initiative or planning or action. It's kind of important to have that lens of equity. It's never something that you should add on at the last minute or that's kind of its own on the side thing. And so I wanted to pull out an example of the recently launched needs assessment toolkit that my colleagues developed, and the way that there are resources that help you kind of consider health equity and embed it in a health agency's work throughout. So these tools are kind of an equity lens tool that came from human impact partners, and it facilitates reflection for those doing a needs assessment, thinking, how would this assessment be used to make decisions and develop recommendations? Who are the key groups who would be impacted, and how would they be affected? Are the voices of those groups affected by dementia at the needs assessment table? How would the needs assessment be perceived by the affected groups, especially given the history of the issue? How would the needs assessment process be designed to support those groups' engagement, and how can their participation be ensured? And lastly, how will the needs assessment and recommendations process attend to and prioritize disparities? So having a resource, and within this needs assessment toolkit, there's downloadable tools like an Excel file that also makes it really easy to kind of take these and run with it in your work. So just wanted to pull out an example of how those are designed and the ways that that could be used in those working on healthy aging broadly or on the Healthy Brain Initiative specifically. And next slide, please, and I will pass it over to Priya.
Thanks, Claire. Thanks for sharing information about the Healthy Brain Initiative module. We also have another module in our e-learning platform called the Healthy Aging module, also known as the Integrating Healthy Aging into Public Health module. And this module includes a multitude of resources to help state and territorial public health agencies in gaining that foundational understanding into why healthy aging is a public health priority. It also shares the role of public health in aging healthily and highlights steps that public health agencies can take towards taking action towards promoting healthy aging within their jurisdiction. So as I've listed here, the module itself has a variety of content to help support learners in their knowledge of healthy aging. The first three are videos titled A Cautionary Tale, What is Healthy Aging and the Future of Healthy Aging. And it really just shows scenarios of what it looks like when access to quality healthcare is limited, when tools and resources to support healthy aging are available and utilized, and when systems to support equity and aging are in place. We also have on the right there in that screenshot is a Healthy Aging 101 brief that shares frameworks that public health agencies and their staff can utilize to promote healthy aging in their jurisdiction. And that's just a 2-pager brief highlighting some of frameworks, including TIFA's framework as well. So I recommend checking that out. And lastly, we have an elevator pitch video and cue card tool that serves as an advocacy tool to help support buy-in from stakeholders on why healthy aging is an important topic and area to prioritize. And that is our last tool that we will talk about. If we can advance to the next slide, please. I'm happy to wrap this up. Talia, if anyone has any questions, but just wanted to say thank you all so much for listening into our presentation. And I hope that you found the materials that we shared about useful, and feel free to reach out if you have any questions. This is our email, healthyaging@astho.org. And we've included a QR code that you can scan if you just want to take a look at our website and some of the materials we have posted there. Team, feel free to chime in if you have any other comments.
Well, thank you, Team ASTHO. Wonderful resources, and really appreciate all this great work. Can we, Karan, can we take the PowerPoint down for a bit? And so this is the time for you all to unmute yourselves. And if you have any questions, we have a wonderful panel of experts here who can respond to your questions. And just go ahead and come off of mute and show your video, show your picture if you are willing to do so. You can raise your hand or just go ahead and come off mute. And I'm going to take advantage of my position as moderator to ask the first question, as I like to do. So Talia, you talked about a technical package on healthy aging. I wonder if you could describe for our participants here today what might be in that package, and if, how might that be helpful for not just state, but also local health department practitioners.
Definitely. Well, glad that piqued your interest. It has been something, we've been enjoying working on behind the scenes. We have, our team has been working through a number of steps to do a literature review, get input from experts, including a former health official who has some work in the aging space previously and currently. And we have drafted up a few different elements. I will give a high level overview, but know that this is a draft. We're still working on putting it all together. And it's also an iterative process. So some of the things that were kind of key criteria for us are the opportunities to make an impact, both for healthy aging and for the older adult population specifically. Some of the things that have come to mind are more in that social determinant and structure type of area, like designing healthy communities that are supportive both of older adults, but with design and planning that is supportive of people at all ages. Another in that area is we took to the paid family and sick leave that is mentioned in the COVID-19 health equity technical package. That's something that interests us quite a bit, recognizing the benefits for people as they age, as they give for people that they have in their families or communities, but also that is a tool that can be used to support people who are caring for newborns and things like that. So again, having these like multiple touch points across the lifespan. And then some of the other key things that we have been thinking about are the workforce, that I'm sure is a buzzword for many of you, and not just to make it a buzzword, but because it's a really big challenge, and public health has a great opportunity, we believe, to make an impact on supporting a robust workforce that can be sustained through incentives and support. So those are a few things that are on our minds, and we will hopefully be sharing more soon about that technical package, what's in it. I think for those who are in a state health department or a local health department, I think you could use it to inform your work and what you might prioritize. Our goal is to help kind of do some of the lifting of prioritization through the technical packages and make it easier to think through what are some high impact areas I could invest in. So that might inform your own work, or might be a tool that you would offer up to a colleague that you work with, or a leader at your agency.
Awesome. Thank you, Talia. I can't wait to see it and help promote it, because I think it'll be very, very useful and very practical. Other questions?
I have a quick question. I would come on Zoom, except for I'm in the carpool lane, and I'm trying to make sure I don't miss the child that I'm supposed to pick up. But as a current master's in health science student at Johns Hopkins, my interest is in older adults and those with early onset serious mental illness. So I'm curious as to, and I don't even know, I just joined different settings just to learn, where do they fit into this whole idea of healthy aging, living well? You know, I'm just, sometimes I feel like that community is almost being forgotten, or I'm just not connecting with the spaces where they are a priority. So I just was curious about that.
Talia, Claire, anyone on your team like to respond?
I can't say that this is like officially included. I'm also, for full disclosure, relatively new to ASTHO's Healthy Aging team. I'd say in the context of the kind of priority areas Talia just described, I feel as the workforce is really relevant there, and having a workforce that's trained and skilled and cognizant of like both aging and later life and dementia, but also the appropriate kind of evidence-informed care strategies for serious mental illness. And if those were to intersect, the most, knowing that often, particularly in skilled nursing facilities, there can be some overuse of certain types of medications. That's one example that comes up in my mind as maybe a way that would be supported through workforce approaches, recognizing that as a group. And then, yeah, that I don't think is a formal ASTHO talking point, but it's what it brings to mind for me.
Thank you, Claire.
Thank you.
Great question, Lisa. Thank you for being here. Thank you for asking. I know that mental health, behavioral health is a key issue. And I do agree. I don't think it's that we have dived into it, as much as I think we could, and develop guidance. So that's definitely an area that I think that we all can do a better job at. Other questions?
Yes, hi, Glenfield from Office of Rural Health in North Carolina. And I am part of the BOLD initiative, building our largest dementia. Yeah, okay. And we are talking about trying to interact with the health departments. And I'm hearing a theme of workforce, and I'm heartened to hear that people are cognizant of that. I would say I don't know what it's like in other parts of the country, but here in North Carolina, the health departments have really taken it on the chin. And I don't mean just COVID. I mean for the last 20 to 25 years of reduced funding, to the point where they are only doing those federally required services for women that are pregnant and that kind of thing. But adult services in many of the 80 or so health departments have dried up and gone away to FQHCs, for really qualified health centers, which is a real point of contention for health department people. One of them, who is a veteran director of a large health department, said about 5 years ago, I was in the room, he was with about 6 other health department directors, that he predicted that in our state, health departments would no longer exist within 10 to 15 years. I thought that was a really alarming statement. I'm telling you all this because I'm really excited about the material you put together and would very much like to bring it back to my group. But step number 0.001 for me would be, how can we even get the attention of the health department or the health department association, who is so put upon and is always being asked to take on more without any additional resources in terms of money or people. I'm sorry it took so long, but I felt like I needed to give you some context.
Yeah. No, it's a great question. ASTHO team, I'll turn to you first.
I'm happy to share some thoughts that come to mind for me, Glenn, and definitely welcome my colleagues to chime in with others. Yeah, I think that's a really interesting context and perspective, and it feels more frequent that in conversations I have across ASTHO or with partners or with health departments, that the topic of just the effect on the public health workforce, not just through COVID, but over the last several years, that the impact that that's had on capacity and bandwidth and just ability to kind of expand into other areas or kind of think, like have that time to think creatively and strategically. That is definitely something that is on the minds of folks at ASTHO. It's not our primary focus, but obviously it comes up as we interact with health departments. But there is a team that is focused on workforce of the public health system and some new initiatives around resilience of the workforce. I know that's not in itself the solution, but just so you know that is going on, and we can certainly share some of the resources going on there. We have as one of our other core functions that our team is not directly responsible for, but is a strong and small, growing and mighty team. We have a government relations team that has some legislative priorities that heavily focus on funding for the public health system and infrastructure, and they have some goals around making that investment increased and sustained over the long term. And I know they've been working with partners, I'm sure, including TIFA, to promote that need and speak to that need, in addition to looking at current funding that states and other jurisdictions do have, especially around COVID-19 funding. How are states and other jurisdictions spending that, and how can we demonstrate that spend, need, and impact that it's having? So those are a few things that come to mind. It might not be exactly an answer to your question, but those are a few things in the background, and happy to hear from colleagues on the ASTHO team or TIFA team if you have other thoughts.
Yeah, thank you, Talia. So I just put in, Glenn, a link in the chat to TIFA's most recent report on the chronic underfunding of the public health system. And we also have a very strong government relations team that advocates for public health funding, strengthening of the infrastructure, data collection, all the areas that public health needs support for, right? But when it comes specifically to healthy aging, I think one of the most important things that can be shared, one of the most important pieces of information is just the growing older adult population in your state, because every state has a growing older adult population. And so data is just a great place to start. I also commend the crosswalk between the state health improvement plan and the state plan on aging, because I feel like there are areas there that where if you can get like a couple of the agencies within the state to agree to work together, it's a great place, you know, to kind of launch some of that work. And then finally, I'll mention, and I don't know if our friends from California can speak to this, but you know, many states are working to develop master plans for aging. California is implementing their master plan for aging. New York is developing theirs. Tennessee, Michigan. There are a number of states where these are being, you know, thought about. So that's another area to bring together, you know, a multi-agency effort to focus on the addressing older adult needs, whether they're health needs, transportation, physical activity, nutrition, you know, elder justice. There are so many areas where, you know, that you can leverage the interest and, you know, of other agencies and potentially the funding of that other agencies may have. We are aware of, we work in Washington State, and in Washington State, they are working on looking at the designation as an age-friendly state through AARP. And the funding to do this initial exploration is not coming from the Department of Health. It's coming through a SNAP-Ed program. So like there may be other ways of thinking about, you know, some different funding streams that might be leveraged to move the needle a little bit.
Thank you. That's really helpful. Appreciate it.
You're welcome. You're welcome. Other questions or comments?
Megan, this is Jane. And
Hi, Jane.
Such a great webinar, as always. It was just a wonderful presentation, and more importantly, the work that you're doing. ASTHO, what a great partner for Trust for America's Health and for the foundation. Megan, you were just saying the things that I thought maybe I'd respond to as well, and about the connection between the aging plan and the state improvement plan, and then where does the master plan for aging fit in? Is it just a collection of those, or does it add more? And also a comment, I think, to someone else that mentioned, you know, what's ever good for the most vulnerable in our society is good for everybody. So whatever is good, going to be good for aging, is going to be good for all. So my question, I do have a question, Megan. So the question for Talia is, and I think you might have covered it, but maybe emphasize, how hard was it to get people to work together on this crosswalk and to think about, you know, where the duplications are, where the gaps are? Was there a lot of territory or not? But just like to hear a little bit about that.
Sure. It was honestly, with the group we worked with, it was smooth like butter, is how it comes to mind. They had an existing relationship with one another, particularly born out of pandemic response and addressing the needs of older adults in their state, as well as bold funding. Agreed, Jane. Yeah, Liz is a star.
We love Liz. Yes.
I was going to say she loves you and she loves this work. And I thought,
Yes.
Wow, when you said that it wasn't as hard, and I thought, oh yeah, that's right, it was Liz. Yeah.
And I mean, I think they had that existing relationship, which was powerful. And just such a strong commitment from each individual person to be present, to work together, to really like dedicate their time. And in reflecting as well, towards the end of the project, they reflected that it was helpful to have kind of that container of space to connect with one another and accountability that ASTHO and TIFA provided through the process. I think if for a jurisdiction that might want to embark on a similar project where they're new in that relationship, it might take some time. Like there might need to be time built in for that relationship to develop and kind of begin to understand each other's language. That seemed to be a critical foundation that they had that made it pretty easy to kind of move along in conversation without too much translation back and forth, for lack of a better metaphor.
Great. Thanks, Talia. Thank you, Jane. Other questions? We have about 5 more minutes.
And there's a question in the chat. Let's scroll back up from Deborah John. Has anyone considered one challenge of addressing / advancing healthy aging is the ageist perspective of defining aging by chronological age, ergo Medicare eligibility?
It's a good question. We know that, depending on what policy or what agency even that you're looking at, that sometimes age is defined, or older age is 60 and over, or 65 and over, or the oldest of old. But I know it does have some interesting challenges to it, because those who are 65 to 75 do not have the same health challenges as those who are 75 to 85. So this is true. Deborah, go ahead and unmute yourself. We'd love to hear from you.
Hi, thanks. I'm Deborah John. I'm at Oregon State University, and I just came off of a year of working with the President's Council of Sport, Fitness, and Nutrition on the physical activity guideline mid-course report focused on older adults. And so I have a very real recent experience of trying to explain a phenomenon from the perspective of a population that tends to be defined either chronologically by some age, and it's not consistent. So, you know what you said, the age varies, or by a criterion descriptor, older, which also isn't very useful, and it tends to other people into a category that actually doesn't help to explain what contributes to opportunity to age actively, healthfully, to thrive, to be independent. This is not something that happens, starts and stops at a period of time, right? It's a developmental process. And if we're going to speak to aging, I think that we need to begin to change the conversation away from a subgroup of people who are adults that are defined very loosely, depending on who's asking the question, to basically the reality of healthful lifespans and what that means. What kind of resources do people need easily to access? What kind of conditions that change across the life course do we need to understand to make sure that people don't all of a sudden find themselves isolated because now they can no longer see to drive and cataracts, right? Surgery that goes bad, then all of a sudden they can't actually they have no access to transportation, and they happen to live in a community where that was how they managed to live and thrive in their community. We don't really think about the context, the circumstances across the life course. You know, I heard somebody mention something about the workforce, and I've been doing some recent kind of exploratory research on what happens when people, regardless of their age, leave the workforce and now all of a sudden become part of the, you know, we'd like to call them retired, but they might just be unemployed.
Yeah.
And in that, you know, what supports are available to people? I'm learning that there are not many, right? Unless people have built their own set of supports and are leaving the workforce at an age where they might have access to some of the supports that are built into our social systems, they literally are on their own. And that is an awful place for people to be, to navigate systems. You know, I have a lot of care and compassion, and age-wise, I fit into this category. And, you know, I'm a still employed older adult, and I plan to be for quite some time. But I don't know. I just think that we have to shift the conversation if we're really going to be effective in dealing with an aging population that is going to increasingly place burdens on both individuals, families, and our social systems, because we have not built them to be efficient, effective, and
all encompassing.
yes, exactly. You know,
Yeah,
I don't
yeah.
even, I don't even know how to say it, you know,
Yeah.
certainly not connected.
Mhm.
Yeah.
Well,
So
thank
that's
you.
my soapbox for today.
Thank you so much. Thank you so much for sharing, Deborah. I mean, I think that you really have encapsulated, you know, one of the primary challenges that we in public health are all trying to address in just bits and pieces. Like we're biting off. I feel like we're just biting off little bits and pieces to try and get to this issue. And so I totally appreciate where you're coming from and appreciate your being here today. We are at the end of our time. I would love to continue this conversation. Hopefully we will next month. I invite you all to join us next month. We will be talking about healthy aging in the context of our 60s framework, in the context of social determinants, and with a focus on equity. Trying to bring all of that together. So please go to afphs.org, our website, to the events tab. You can sign up for the next training, which will be December, the third Thursday in December, which is, I think, the 15th. So December 15th at 3 p.m. Thank you to the ASTHO team. You all have been terrific. Really appreciate partnering with you. Appreciate all the great work that you are doing to support older adults and the public health field. And thank you all for being here today. We look forward to seeing you next month. And thank you all so much. Have a good holiday, a good and safe holiday.
Thanks, everybody. Thank you. Bye.
Bye.
Thank you, everyone. And this is our official closing that I will be sharing. So thank you all for joining us today. If you're viewing this recording, if you were viewing this as a recording, pardon, please pause the video at this point and navigate to the web address below to indicate that you have viewed this training so that we can count your attendance virtually and mark you as one more training away to becoming an AFPHS champion. And thank you again for attending.
Thanks, everyone.